In this video we comment on the content about digitalis intoxication in ECG Corner. 40 or 50 years ago, digoxin was one of the top 50 prescribed drugs. It was used for heart failure, for rate control in patients with atrial fibrillation, and also to prevent recurrences in various types of supraventricular tachycardia. Today, digitalis intoxication is uncommon because it's not used so frequently, and it is usually related with renal dysfunction, drug interaction, or hypopotasemia. Because it is uncommon, digitalis intoxication may be overlooked. This table reflects how the use of digitalis has declined in patients with heart failure. Thus, in the consensus trial that was published in 1987, 74% of the patients recruited in this study received digoxin. Conversely, in the SHIFT trial that was published in 2010, only 22% of the patients were on digitalis. The development of digitalis intoxication can be influenced by several factors. Some of these factors cannot be modified, such as the age, the gender. Females are more prone to digitalis intoxication, chronic renal failure, and severe myocardial disease. Amyloid heart disease is also a situation in which patients frequently can develop digitalis intoxication, and the same occurs with cor pulmonale, but these two situations are not as prevalent as the four that have been mentioned before. There are other factors that can be modified, such as electrolyte disorders, hypopotasemia, hypomagnesemia, and hypercalcemia, a reduction in the renal function, in the glomerular filtration rate produced by drugs or dehydration, worsening of heart failure, and the many drugs. There are many drugs that can interact with digitalis, resulting in digitalis intoxication: quinidine, verapamil, amiodarone, propafenone, and so on and so forth. Hypothyroidism and myocardial ischemia also make digitalis intoxication more likely. No arrhythmia is diagnostic for digitalis intoxication. Digitalis intoxication can produce conduction problems and also enhance ectopic impulse formation. Typical sites of ectopic impulse formation in digitalis intoxication are the atrial myocardium for ectopic atrial tachycardia with block, the atrioventricular junction for non-paroxysmal AV junctional tachycardia, and the ventricular Purkinje system for ventricular tachycardia, and also ventricular premature beats. Patients developing digitalis intoxication can present various types of cardiac arrhythmias. Thus, you can observe impaired sinoatrial impulse formation or conduction manifested itself as sinus bradycardia, sinoatrial block, or sinus arrest and atrial standstill. You can also observe impaired atrioventricular nodal conduction with various degrees of atrioventricular block and up to complete AV block. Also, the patient may exhibit signs of an enhanced ectopic impulse formation leading to atrial tachycardia with block, non-paroxysmal atrioventricular junctional tachycardia, ventricular ectopic beats, and eventually bigeminal rhythm, slow ventricular tachycardia, bidirectional ventricular tachycardia, and polymorphic ventricular tachycardia, and sometimes even ventricular fibrillation. It is characteristic that a patient intoxicated with digitalis will exhibit a combination of the above disorders. This is an example of digitalis intoxication in a patient with atrial fibrillation that developed ventricular bigeminy. Note that we have one narrow QRS complex followed by a ventricular premature beat with an almost constant coupling interval. This is a patient that also was in atrial fibrillation in whom digitalis intoxication is manifested by the regularization of the ventricular rate, as you can see here. This reflects the development of AV block during atrial fibrillation. So notice that the RR intervals are almost constant, close to 1360 milliseconds, so they vary from 1360 to 1400 milliseconds. This electrocardiogram is from the same patient that we have discussed on the preceding slide and illustrates a second mechanism of regularization of the ventricular rate during atrial fibrillation in a patient with digitalis intoxication. In this case, is the development of non-paroxysmal atrioventricular junctional tachycardia. Notice that the rate of the tachycardia is not very fast, and this is characteristic of this arrhythmia that is very typical in digitalis intoxication. This is a case of digitalis-induced atrial tachycardia with block. Note that there are two P waves per QRS complex, and that the P waves of the atrial tachycardia are not regular. In fact, the PP intervals that comprise a QRS complex are shorter than the PP intervals, not including a QRS complex in between. This phenomenon is called ventriculophasic atrial arrhythmia. It is common in digitalis-induced atrial tachycardia with block, but it is not pathognomonic of this condition. In this slide from a patient with digitalis-induced atrial tachycardia with a 3-to-1 block, we illustrate the transition to an atrial standstill with a pause of more than 7 seconds. Finally, we show in this slide a very rare form of digitalis-induced ventricular tachycardia, the so-called bidirectional ventricular tachycardia. Note that in lead V1, all the QRS complexes exhibit a right bundle branch block configuration, but in the extremity leads, the axes alternate between a right-sided axis and the left-sided axis. Although bidirectional ventricular tachycardia can be observed in patients not on digitalis, its presence strongly suggests digitalis intoxication if the patient is on digitalis. You are advised to go to the essays section of ECG Corner and look for digitalis intoxication. You will find there a detailed and well illustrated interactive account on this topic. Enjoy digitalis arrhythmias lessons.